You got a couple minutes yet.
Yeah, we do. Just so I get it rolling so people can see it.
Time's the peers meeting.
What's that?
Time's the peers meeting at.
6:30. You know, Ben and I presented the same thing to our board. And talking today, and, you know, we're
Kurt, you want to turn the mic on? Keyboard's in front of you.
Let's see if I can mess it up. I just have to hit unmute.
Yeah.
Perfect.
Yep. You know, there's just enough seats for the three of you to join, so you could be on camera as well.
All right, we got 5 o'clock. Okay, I'd like to call this special board meeting in order. Roll call.
Mater here.
Vandy Creek here.
Johnson
Van Lannon here.
Fiskachel here.
Garrigan here.
We have a quorum. Please stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we get a motion to adopt the agenda.
So, I'll second it.
Okay, all in favor?
Responding.
Yeah, roll call. Let's do a roll call.
Vandy Creek, aye.
Johnson.
Van Lannon, aye.
Fiskachel, aye.
Garrigan, aye.
Thank you, Michelle. Okay, can we now have an adoption? Oh, we just did that. Okay. Citizens and delegations, is there anybody who would like to speak to something that's not on the agenda? Not on the agenda. Okay, great. Okay, so our action item is on remote learning. And I just want to say that we have received, I don't know, 50, 60, 70, 80 emails. Everybody's gotten them. Everybody's seen both sides of the story here. So tonight's meeting, this is just going to be a board-only discussion. We're not going to hear any discussion from anybody else that's in the audience or that's listening on YouTube or in front of us on the screen. And I'm going to turn this over to Kurt.
All right, thank you, Jay.
Yeah.
So first, I want to thank everyone who joined us in attendance tonight, and those who are joining us virtually, whether you are in the Google Hangout or you are in the YouTube channel. So thank you for joining us. I want to start off tonight by first, once again, thanking our students and our staff. So I'm speaking to students, if there's any of you watching out there as well, for your resilience during these unprecedented times. This isn't easy. It's not easy. It hasn't been easy since March. But I'm really very proud of our staff and very proud of our students and how they've handled, and our parents, and how they've handled all of this. So thank you for all of that. I also want to mention that I'm just really impressed with our staff and our amazing staff that they're doing during this pandemic. They are working long hours, putting in countless time over the weekends preparing for remote learning. Just as challenging and difficult that it is for our students, for remote learning is just as challenging for our staff. Trust me when I say they, and I mean they, including me, want to be in person. Nobody wants this more than our staff and myself. If we could go back to last February, we would do that in a minute, trust me. I think everyone feels the same way. At our school board meeting last week, Jamie and I presented our data and decision-making guidance for us to consider when moving from one learning scenario to another. This guidance provides us with some mathematical data to take into consideration when making decisions. This guidance also provides us with local data for us to consider. One of those local data points is the amount of staffing needed to support our schools and for them to operate efficiently. And that takes into account those staff who have tested positive or in quarantine. We are following closely the recommendations from the Brown County Health Department and State of Wisconsin Department of Health in regards to what do those quarantine guidelines look like. And I think that question came up last week. As I have mentioned before, we would be okay one day and not very good the next day. And so I'll give you an example of that right now. Last week, on Thursday, we reposted data. The data gets updated, as all of you know, on Mondays and Thursdays. Last week, Thursday, we had 13 staff who were positive or quarantined. Well, we didn't have a very good weekend. And so the data changes quickly because today we had 24 staff who were quarantined or tested positive. So again, those things change quickly. And so that's our ability to adjust based on the amount of subs. And as all of you know, that was one of our criteria for going virtual or remote the first time. Our other two core indicators in our guidance list the community burden rate of 1,142 and a positivity rate of 39.2%. When we made the decision to close on September 25th, we had a burden rate of 835 and a positivity rate of 15.4. So you can clearly see that the numbers are much higher than they were when we
You want to
closed.
explain what those numbers are?
So the burden rate, for those who don't know what that means, it's on our website, and basically that talks about the amount of cases per 100,000 people in our community. And roughly, Jamie, we're about 250,000 in our neighboring Green Bay community.
Would you like me to share that dashboard?
What's that?
Want me to share the dashboard on the screen?
Sure. If you look at our website, which Jamie Everbeck is going to now put on the screen, you'll be able to see the numbers that I'm referencing. Maybe.
Maybe. I forgot that I hid the screen. Sorry. Waiting longer. Okay.
And so those are on our dashboard. Again, we want our community, we want to be totally transparent. We want our community to know how we're coming up with these numbers. These aren't our numbers, these are community numbers. So again, our core indicator one is that burden rate of 1,143. When we closed, we had a burden rate of 835. Our core indicator two is 39.2% positivity rate. When we closed, we were at 15.4.
And what were those numbers when we started school?
Yep, so JD asked a good question. What were the numbers? Again, I may be off by one or two, but our burden rate was about 244 and our positivity rate was about 8.7. So you can clearly see our positivity rate almost doubled by the time we closed. And our burden rate almost went up by 4 by the time we closed in that month that we were in school. Now, again, our students and our staff, our parents, everyone did everything right. It was great. Everyone really did a wonderful job. However, our numbers still went up and we still have lots of cases. And eventually it came down to one of the deciding factors was our ability to staff our buildings. as all of you remember from a communication that came from me. So again, as we look at today, as I mentioned before, staff absences, I know it's a little bit hard to see at the bottom of the screen. Last week was 13, if you look at the second to last one, and today was 24. And so again, we share those numbers with you just so everyone has an idea of some of the other pieces of data that we're looking at to make decisions. Also remember when we closed, we had 8 on-field teaching positions that we couldn't fill for the day and 4 on-field support staff positions. Also want as I shared at the board meeting last week, I don't want our parents and our community to feel like we haven't tried. Since we closed, we have gone on a recruiting trip and we have worked extremely hard to try to recruit more subs. In fact, we even gave them a huge pay raise in order to get them to commit just to us. And so we went from having a community, we went from having a rate of roughly about 155 to raising it to 2. We've given them long-term sub pay to 225, 222 in order to do that. So don't feel like we haven't tried. We are trying. We continue to try and try to lock in more subs in order for us to be in person. Again, we can't say it enough. We want to be in person. That is clearly the case, and we clearly are trying. At last week's board meeting, it was suggested from parents and from the board to take time to survey our parents and to survey our staff to get a true indication of everyone's opinion in regards to remote learning and whether or not we should be transitioning back to in-person learning. That was a monumental task. And I want to give a huge shout out right now that these results came directly to Mandy, Jamie, and myself, but would not have happened without some great work behind the scenes. And so this happened Friday. It is now Monday. Not only did the survey get developed, get out to our parents and to our staff, but then it was tabulated. So you can imagine what we did on Halloween, right? And all of that work happened. And a sincere thank you to Mandy Schrader, our communications coordinator, and Jamie Aberback, our instructional technology coordinator. Great work, Mandy and Jamie, so thank you. Some have asked me, and it's a fair question, about the timing of the survey. Again, it was a result of some of you in attendance tonight who asked us to survey our parents, and we did that. Some asked, well, why, Kurt, is the survey still going until the 4th? A good question. One part of the survey is to ask what we're deciding tonight, right? One part of the survey is to ask, how comfortable do you feel in person at this time, or would you rather still be remote? That was only one part of the survey. The other part of the survey, which is the part we're going to look very closely at and have, not that we haven't looked at the other part as well, is what can we do better if we end up staying in remote or going to remote again in the future? And so we're going to use that information. Many of the feedback that we've gotten in open comments from parents was, Kurt is 100 times better this fall than it was last spring. That is very clear from our parents. But that's a direct result of the survey that we did last spring. We took the feedback from our parents last spring, and we worked extremely hard over the summer to come up with not only a reopening plan, because that's what we want, to be in person, but also took a lot of value in the comments of how can we improve the remote instruction if we have to go to that. And so that was very clear from the parents that it's much better. Do we still have areas to get better at? 100%. And we will continue to do that and use that feedback to do that, okay? So that's why we wanted to give parents enough time to do that. So I don't want people to feel like, why extend it if we're voting on something, on part of it tonight. Also know that our board members were supplied with that data already. So all the data that's been handed in and the survey results, our board has had that opportunity to look at it. And they were sent that sometime this morning, about 11:30 or so. Okay? So know that all that information that you supplied, our board has been given that information. With all that being said, excuse me, I'm just gonna take a quick peek. We had a tremendous participation. So that quick turnaround, people responded, and we're very impressed. That continues to be a tremendous support of our community. You look back to our referendums and all the things that we do in our community responds. And you responded to the survey, which was fantastic. I want to personally thank everyone in attendance and watching for taking the survey. We truly appreciate the feedback. We had 2,092 parents and families take the survey out of a possible 3,226. That's fantastic. Important to note, though, parents can take the survey 3 times if you had 3 children. And we wanted you to, because you should be representative of each of your children. Okay? Then for the staff survey, we had 283 staff members take the survey out of 388. Again, tremendous turnout. So we feel the results that we have shared with the board are really reflective of how our stakeholders feel. Okay? Jamie and I are now going to take some time to share the results on the screen so everyone can kind of get a clearly idea of what that results look like. Okay? Jamie, are you ready?
Yeah, good.
I didn't mean to put you on the spot.
No, we're good.
So, go ahead.
Okay,
Yeah.
so, and again, I'm sorry, this is hard to say, and my YouTube audience, I'll do my best to explain. I'm realizing you can't see the screen, so I apologize for that. But what we did is we asked our parents, some questions about how comfortable they were. And the first question was, how comfortable are you with student safety in regards to in-person learning? 58.5% said they were comfortable, which was a 4 or 5 on the rating scale. 29.8% said not comfortable, which was a 1 or a 2 on the rating scale, and then 11.7 for the 3s, and not sure.
So if you couldn't hear Jamie, for those out there, if you chose a 4 or 5 that you're comfortable, you were listed as feeling comfortable. If you chose a 1 or a 2, you were listed as not feeling comfortable, and then the 3, if you chose neutral, we put you in a not sure column. Okay?
And then a similar question was, how comfortable are you in having your child attend school in person at this time? We had 58.9% in the comfortable, 10.1 in the not sure, and 31% in the not comfortable. We then asked, how comfortable are you with teacher and staff safety in regards to in-person learning? We had 52.4% of our parents were comfortable, 14.4 were not sure, and 33.3 were not comfortable. And then the fourth question about that was, are you concerned about your child's social and emotional needs? 43.6 said they were a little concerned, 33.4 were I'm very concerned, and 23% did not have any concerns. And then we asked some questions about the actual remote learning experience. So so be patient with me, I'm learning Google Data Studio and I'm getting okay at it. But one thing I can't do is get these in the right order. So overall, how would you describe your child's learning experience? It kind of goes from dark green being very difficult to the next green is somewhat difficult. So that's going to be, basically our negative side of the experience. And then the other side of the experience is from it's challenging and getting better to good to great. So the majority, about I would say what 60. About 60% or so are in that it's getting better to great category. Areas going well, and those of you who remember when we shared our spring data, the technology coordinator and me is really, really happy to see Google Meets, Seesaw, and Google Classroom listed as things going well. Because something we heard in our spring data was too many places to go, too many things to click, and we've definitely tried to streamline that process behind the singular venues or I guess modes of where we're going to communicate. So that makes me very happy. And also technology needs is up there as going well. So that's me, again, looking at this through my lens, right? But also up here, we obviously have daily interaction with teachers, communication with the teacher, as things that are going well. Things that aren't going so well, and again, this isn't going to surprise anybody, daily interaction with other students, appropriate amount of work, meaningful activities, daily interaction with teachers showed up on both columns, and then feedback. And something that Kurt referenced, and again, this is a big part of my job being in special technology, this is really powerful stuff, because actually what I like the most about these things that are on the not going well, all this is substance stuff that I know that if we go back to our teachers with, hey, how can we find more ways for students to interact? We'll have lists of things that we can do. And we already have lists of things that teachers are doing. So what I like about the things on this not going well list, there's nothing on this list that I'm afraid about bringing back to our staff. Well, how can we get better? They'll tackle this very knowingly, and that makes me happy. The next three charts, again, are really positive data. It talks about the ability for your child to complete their work. 61% are in the yes, 32% are in the sometimes, and only 5.7 are in the no. So we have a very high percentage of our kids completing their work. Access to materials, 75.7 is yes, 22.4 is no, less than 2%, or I mean sometimes, sorry, less than 2% is no. The ability to reach your child's teacher, 61.6 is a yes, 32.7, sometimes 5.7 is a no. These three things were all listed as areas of need in spring. So it is very exciting to see us have high percentages of yes in all three of these things. So again, a lot of positive reinforcement in this data for us to think about where we've come, but also some good stuff for us to think about where we go forward. And then we've asked this question, I think, in every survey, and it's come through loud and clear. By far, our preferred communication method with our parents is email. And even though we have 142 people on YouTube right now, social media is fairly low on the list, which is pretty interesting. But yeah. So any questions on the staff side, or would you rather me go, or I mean, the parent side, or would you rather me go to the staff side and then do questions together?
Go ahead and do the staff side.
Okay. So I made the staff different colors so that it would, I have to change this to view, sorry.
So can I ask a real quick question? What was the percentage of those who did do virtual and in person at the beginning of the year?
It would be right around 82% in person, 18% virtual.
Yeah. So on the staff side of things, again, we asked some comfort feeling level questions. How comfortable are you with returning to in-school at this time? 65.4% of our staff are not comfortable, 15.3% are not sure, and 19.3% are comfortable. How comfortable do you feel about the safety of students? 63.7% are not comfortable, 16.3% aren't sure, and 20% are comfortable. How comfortable do you feel about the safety of teachers and staff for in-person learning? 68.5% are not comfortable, 15.3% are comfortable, and 16.3% are not sure. And then we asked two questions about the overall experience. And I was excited to see this because when I just talked to you about what parents reported, about that 60% of being from improving to great, that same percentage is right here. The parents and teachers are in absolute agreement. It's almost the exact same bar graph of what we think about for students. About 30.6 saying, hey, it's getting better, 24% say it's good, and then we have a sliver saying it's great, and then obviously we have that same area of need. On the teacher side of it, 41.6% say it's getting better, 25.5% say good, and another 4% say it's great. So I thought that was very interesting that the staff and the parent side absolutely mirrored each other on the overall experience. I know that someone had asked me about pulling this out by building. I absolutely can do that on Thursday when the survey is closed. Because these are live surveys and pulling the data in the live, it's really hard to manipulate that spreadsheet in the amount of time that I had. In fact, run a lot of filters. It'd be after Thursday, it'll take me minutes. So that is something that for the next board meeting, I absolutely can have this pulled apart by building and age levels.
In fairness to staff, and I think I should just say that, and I don't want you to feel like I'm trying to defend them. They want to be in person. I have yet to talk to a staff member, trust me, I don't think there's too many staff members in our district of our 388 employees that I haven't personally talked to at some point in time. And they want to be in person. They are not trying to have the easy way out. It's easier for them to be in person than it is to be virtual, trust me. And clearly see that. We clearly see the amount of hours and time that the staff is putting in. You know, just like I mentioned before, it's just as more challenging for our students, it's just as challenging for our teachers, or more challenging. They would much rather be in person. So don't take this results that they don't want to be in person. They're telling you how they feel right now based on our community spread and the numbers and everything else that's in our community. So don't take it as they don't care, don't take it as they don't want to be here. That is absolutely not true and unfair. They want to be here. They love their job. That's why they do what they do. The last board meeting, many of the parents that were spoke said, we think the teachers are fantastic. We think the teachers are doing amazing work. Again, I don't want that survey to reflect that you don't feel like they, because that's absolutely untrue and not fair. They absolutely want to be in person. They absolutely love their job and do great work. So based on all these things, the board, you received a recommendation from me. That recommendation is to continue with remote learning through Thanksgiving. I'm very concerned about the rate, the burden rate. I'm concerned about the positivity rate, which is, basically almost 5 times what it was when we opened up in September. Where it was 8% and now it's almost 40%. I'm also concerned about the amount of subs. Don't get me wrong, we've done a great job, as I mentioned to all of you last week, of recruiting more people. We think we'll probably fall in that range of having 18 to 20 committed subs. But you look at today, we had 24 staff out, okay? I'm not making up the numbers, I'm just telling you what it is. That's my job, to be totally transparent and present you with all the information. But our recommendation would be to wait until after Thanksgiving. But I would love to be in school tomorrow. I cannot say that enough.
Kurt, you had said that, you told me that you had some numbers from West Superior.
Yeah, West Superior's numbers aren't good. And, again, everyone says that we should follow their lead. Yeah, maybe. But if you follow their lead, they're well over 330 people out today. 280 students, 299 students and 31 staff. So 330 people in the West Superior School District are out today.
Any indication of what they're gonna do? Are they gonna continue?
I think they're watching those numbers closely. De Pere is in the same boat. East De Pere is in the same boat tonight. They're meeting tonight. And Pulaski is also meeting soon. So,
As I said when we started, we have a lot of passionate people here in this district, and I don't have any kids in school anymore, so I can't feel what you guys feel. I mean, it's difficult, and you'd think that kids would be motivated, but I look back and we started this in March, and it was a little chaotic back then. Things have gotten better. Kids got a chance to come back into school, and I heard from I don't know how many parents of how far down some of their kids have gone. Some straight A students that just fell right off the ledge. Kids doing their Google Meets, sitting in their bed in their pajamas. These kind of things are just frustrating. And I know that, you look at the science, and the science tells us there's no way we should be back in school. But then you listen and you read all the other data that's out there, and they're saying that it's safer for the kids to be in school than it is to be hanging out wherever else they're hanging out, being in as a group. And then the other thing is we have all of our essential workers are working. People work in hospitals, people work in grocery stores, people working at gas stations, people are all over the place and still working and going back to their jobs. So for me, I mean, I would really love to be able to say, let's try to find some type of blended things so we can get those kids at least in the classroom 1 or 2 days a week, even if it's a half day a week, just to get those kids out of their homes and give the teachers a chance to get organized with these kids, get them back on track, so then they get that face-to-face. And I know that that Mr. Ribbons is vitally important for these kids starting off the second semester with their teachers. Second quarter with their teachers. I don't know if they're changing at the middle school too, or.
Yeah, everyone changes, quarter starts on Monday. Yeah.
So as a teacher, you want to have that face-to-face with those kids right off the get-go. And I know that happened in the fourth quarter, correct, Mr. Ribbons? Tell us what happened then.
And obviously, fourth quarter last spring was very different from where we are right now in terms of our ability to plan and prepare and communicate our way through it. But we found that students who were in second semester courses, in other words, courses that went from January through the end of the year, who had already had a term with their teacher, for those students, their fourth quarter performance roughly matched their third quarter performance. In other words, if they were connected and getting the job done, they continued to connect and get the job done. If they weren't, they didn't get any better. But for our quarter-long courses, which are about 50% of the courses that we teach in the high school, we saw a significant drop in student engagement for those fourth quarter term-long courses, simply because they never had a single chance to be with their teachers and get things going and establish those face-to-face relationships and things like that.
So I see that as another important thing that we need to look at. And, you know, even if it is 10 days, 15 days, especially at the high school and the middle school, getting them so they get face-to-face right at the get-go. And to get our elementary kids back into school and get excited again. I understand what Mr. Wires is saying about, you know, look at the numbers and it's scary. But at our local level here with the kids, I've been churning this thing for about 5 or 6 days and it's just hard. It really is. I don't know if you guys got any comments.
I think it's important to note that in the survey that at just nearly 80% of the parents were concerned about social and emotional needs of their kids, which that was striking to me how high that number was. And I heard that in many of the emails as well from parents that their kids who used to be excited to get up and get going to school in the morning now are being dragged out of bed to get started, which is difficult to hear. You know, I completely agree with you, Jay, as far as trying to get people back in and get kids back into the buildings. It may not be safe for us right now, but some of the data that was shared through some of the emails and some of the data that you see in the news indicates that the community spread is not happening as a result of the school. And the comments that we heard, and I think it is actually quite true, is that it is or appears to be safer to be in school with the cleaning that goes on, the safe distancing. As you know, being out in the town during the course of the day, there's a lot of kids in the stores with their parents being brought along, especially the younger kids going into stores with their parents because they are at home. Is that a safer situation to be at Walmart during the middle of the day when there's a lot of other people in the store versus being in a school that's being cleaned continuously? So that's something I think we should be conscious of, and honestly, I don't see this going away. And the numbers, the guidance that we've got is not anything I would ever want to tie us to hard and fast. it's just that, it's a guidance. But I think we're in this for the long haul. And as a result of that, with 80% of kids having issues, social and emotional, it's very important, I think, to get them back in. Now, what else can we do with our staff? Because obviously we heard just the inverse with staff not being comfortable going back in. So what else can we do to, we always say that, if you ask a group of teachers, they'll have a list for you the next day with 10 different items on it. So my challenge, perhaps to some of the teachers that are listening in tonight or to administration, is what else can we do to make it a more comfortable environment or safer feeling environment for the staff. As a result, again, given that the studies show that it's not community spread by first graders, for example, in school, what else can we provide as a way of creating that comfort in getting back into class? And a question for you, Kurt, with the 24 that we had out today. Now, that might be quarantined, correct? Mm-hmm. So that doesn't mean that they can't teach virtually, correct? So unless there's some, they're having.
But it doesn't, if we're in person, we can teach virtually.
Right.
But if we're in person, we still need someone to supervise the kids.
Correct.
Now, we'd like to think that our kids will all sit perfectly in their chairs,
No, I
and
know.
do everything right, and we could just have someone teaching them through, that's not gonna happen, right? So we still have to staff that room, right?
Correct.
Somehow, or that class period.
Yep, I get that. Yeah. But it doesn't mean that they're too sick to do anything.
Right.
Kind of is what.
Hard to know, even those who have tested positive, it's hit and miss, Brian.
Correct.
Some are fine to still do that, some are pretty sick and they can't, right? So I think it's a kind of a mix of both, right? But
Yep.
certainly it doesn't help us with the staffing side because we still have to staff the room, right?
Right.
Yeah.
So going back to what Jay had said too, with potentially more hybrid opportunities, whether it be the 1 day a week or alternating days, or and I'm not convinced that we can't open elementary separate from middle school or separate from high school if that's data and that comfort level is there. It feels like we could do that. So I think we need to challenge ourselves to come up with other hybrid solutions that give opportunities for kids to be in front of teachers, even if it is 1 day a week or 2 days a week or morning or an afternoon or whatever it might be, to get that interaction, not only with the teachers but with their other classmates.
And Brian, I don't think that any staff member, and I'm not just, this is discussion, right? And I don't think any staff member would disagree with you, right? Or Jay's comments, right? And the fact that we want kids in person, we think it's more valuable, all those are good things. But I think the hard part, the piece that we're missing about elementary, and it'd be interesting to know once Jimmy breaks it down, I would bet most of our elementary parents filled out the survey versus our high school parents. I don't know that for sure, but I would almost bet on that, where I would think it'd be a much higher percentage. At the elementary level, even though they're in that cohort group of the kids in their class, and we say it's less chance that they're going to contract something, which maybe is true, those kids are also closer to our staff, right? Those kids interact closer with their staff. There's more hands-on. We try to practice social distancing, but they're 6-year-olds, 7-year-olds, 8-year-olds, 9-year-olds, right? And so that ability for our staff to stay safer, I would disagree with, right? That it's just as challenging for an elementary teacher, or maybe even more, because of the fact that those kids are hands-on, especially, you think about our 4K and 5K kids at Cormier. And so all of those things play a factor in that role. So I think it's very hard for elementary teachers to feel like they're not just as easy to contract as anybody else, right?
Mm-hmm.
So.
Yep. And the other comment that I would make is that, I think we need to, as we are ready to reopen or partially reopen, I think we need to get more messaging out to parents and to staff to an extent as well, that, kind of what expectations we would have for them, and how we keep our schools open as a result of their actions. And that might be as simple as, are you staying out of large groups? Are you staying home when you can, as best you possibly can, to keep your family healthy? A lot of the community spread, they say, is restaurants, bars, places like that. Not saying that our staff are out in the bars, but some of our parents may be out in the bars or wherever it might be, restaurants. But trying to give them some encouragement to, help us help you scenario to make that happen. And when kids are experiencing some kind of an illness, not to send them to school. I think that in a number of the emails that we had referenced that kids get to school and now our staff has to deal with evaluating, and not as medical professionals in most cases, evaluating the child's physical condition and then determining, okay, do I send them home? Do I send them back to the class? What if these symptoms are real or more involved or leading to something bigger? So parents, before they send their kids to school, or parents being more understanding when we contact you and say you need to come and get your child because of these reasons, that it's not a fight to go with our staff members. And then likewise, a message to our staff, the same thing is keeping yourself healthy, doing the right things, just like we're saying to the parents. Because again, as we talk about it being a long-term situation, it didn't work to lock down the country. It didn't work to say we all should be wearing masks. Now, I can't tell you that it's been not somewhat effective. It feels like it is, and it should be because of less sharing of the same air. But it didn't do any good to close the schools. So until we see something that's working, it's really a difficult situation. But the kids are suffering, and we recognize that. And for anyone who's listening tonight, we recognize that, and that's the hardest thing, because I think as board members, and maybe speaking more for myself, not for everyone, that's the hardest thing, is that we would like to not have kids be struggling. We like to think of ourselves as having a district that provides great education experiences, and we can't do that right now. So again, help us help you would be the message that we probably need to communicate. But bottom line is, I agree with Jay. I don't think we're ready to reopen right now, given the community, but recognizing that the schools and the children that come to the schools are suffering, and we need to come up with some hybrid solutions that maybe help us improve it, and try to get that engaged, and likewise hear from the teachers. If the staff and the teachers are not comfortable in the kind of numbers that we're seeing in the survey, what can we do to make you more comfortable so that we can get things somewhat going, if not all the way going in the near future? So that's a lot of information.
I think it's great, Brian, and I think I talked about it way in the beginning, so thank you for saying that, because of the comment about it's all of us together, right? What can we all do together to make this better? And we really need our staff included, that includes our staff, our parents, our community, to do a better job of avoiding some of these larger events. We've heard there were Halloween parties with 50-some students at them. We have to stop those events. We have to stop having these large social gatherings. If we really want to be back in school, if we're passionate about being back in school, then we have to do those things, right? I haven't visited my father, in almost 4 months, and he's 82 years old. I would love to go see him, but I haven't. And so we made that decision. So we all have to make tough decisions to make sure that we can get back into school. And so thank you for those comments, Brian.
Oh,
guess I would echo a lot that was, being said, and we are in this all together. I would like to start with saying thank you to, all the people for all the comments, emails, especially in the community for filling out the survey and, and I can imagine, the late nights that Mandy and Jamie did to pull all this information together. So, thank you for all that. There's a lot of passionate, comments on each side, and everyone's right. No one's wrong. And this, you can see it from all, points of view, and it's definitely a hard decision. I personally think that, I do like the blended option. We need to do something. I'm not convinced that we should wait later than sooner. I would rather do it sooner than later. But because the kids are suffering, the parents are struggling, the teachers, obviously are concerned with all this, and rightly so in all cases. So when we closed down the school, or when we went to online learning, it was mostly about the staff. And at that point in time, we had about 29 cases, if I remember right. And most of those were, critical roles that were affected. We can't have kids going to school and not being fed. We just can't have that situation. We had, I think you said 8 teachers at the time that we didn't have subs for. I think you mitigated that risk of, having the subs for the teachers, hopefully. But I also think that, at some point in time, we would be, back in this situation where we would have 29 staff, members, out again. Or be like West of here where they have 31, and it's probably going to grow even larger. So that's one of the greatest concerns, for me is that, we can't have the kids going to school and not have, the teachers and staff available, for them. So
We made it through serving meals at Valley View, but I'm pretty sure the Valley View students don't want Keith and I serving any more meals.
No, but Keith's mom.
Oh, Keith's mom, that's right, Brian rocked it too. So,
Yeah, and right, so we just can't, have that. But and to Brian's point, there's a lot of work to be done. That we're working to, how do we open up the schools, and not the conversation as far as how do we keep them, closed and online. Yeah. So with that, yeah.
Thanks.
Well, you all covered a lot of the things that I was going to maybe touch on. I had my notes that I've been working on. For me, I have slightly different position just in terms of like who my position in the whole mess is, because I do have kids in the district. I have 2 kids at the high school, and because I sub and I continue to sub for if there is a teacher maybe who's out and they're an EL teacher maybe is bringing kids in the building, because some of our lower level EL kids there's no way you can do that virtually. It's very, very difficult. So I have continued to go into some of the buildings since the last meeting. I actually made a conscious effort to try and do a little more investigating on some of like the classroom meets and things like that, because I know there were some parents that were frustrated, but to be honest, like our teachers are working so hard. I have talked to so many teachers in the last week just because I wanted to really hear how they're doing, what they're feeling like. I've been able to be kind of with some Parkview people in high school a lot. So recently I was able to be more with elementary teachers. They all want to be back. Not one of them said they don't want to be back. They all want to be back. When I say how you're doing, half the time it's tears in their eyes. They've never worked as hard in their entire life. They said it's getting better every day. I'm learning more things. I'm trying to figure out how to reach my students. I talked to one teacher who said that she actually is doing Google Meets after 5 o'clock at night with certain students because the parents' work schedule don't allow it. And it's it's a more primary grade elementary teacher. And we're not requiring teachers to work at 6 o'clock at night, but that's what they're doing because they need to do that because they are desperately trying to reach their students. So I truly believe the teachers are doing everything that they can. As a parent, my heart is broken. I said this last week. I have a senior. He's like, why would we, whatever. It's not even my senior year. Who cares? I'm just going to go to college. It's hard for those kids and to see them. When someone says that their kids are doing Google Meets in their bed, that's what my senior was doing. I had to start banging on the door and leaving the doors open and forcing him. And I threatened that he had to come sit and do it at the kitchen table if he wasn't going to go to his desk. He has a desk, but he was sitting in bed. So I get all of that. I have a freshman daughter who also has, she's struggling, it's, most of her classes are going well, but certain classes just don't lend themselves to virtual learning. They're difficult to do. So I understand all of those things. And I always, as more than anything, I'm a mom and a wife, and I love kids, and I don't ever want to do anything to harm children, and I know they are suffering. So I am not opposed at all to looking at, if there's I know at the high school they're doing a good job. On Wednesdays, I know there are quite a few kids coming in those buildings. Parkview, I've been there on a Wednesday, they're getting kids in the building. I think for mental health, if we could even get them in one day a week, it would just do so much to make that connection with that human person, that teacher. I have been working with a couple of EL kids at Valley View, and there's only 2 of them, but they see each other and they're so happy to see another student. So all of those things are wonderful, but then I look at the numbers. I have a science background. I am not a doctor, but that's what my degree's in. And I see this, and to quote, I'm so disappointed we could be doing so much better, I guess, just in terms of how we as adults are modeling our behavior, I guess is the best way I can say it. And again, staff and parents, and none of us are perfect, but I am looking at these numbers. I see the sub numbers. I'm a sub. We couldn't cover that, I don't think. I don't know how we cover that today. Like today's numbers, I'm not sure. We wouldn't cover that today. So I don't see how we can logically go back right now, but I think we need to think outside the box and try hard to, as you said, Paul, sooner rather than later, figure something out. I think that might be it. I have received emails, as we all have. I've also received personal emails from people I know, that know way more about medicine than I do, that I value and trust. And I can tell you I've received the same number of emails and comments from people in that field that want us back, and they're saying it's not safe to go back. It is equal for every person I talk to that tells me this. And I think, okay, well, I really trust them. They're awesome, and they're very intelligent, and they are excellent at what they do. I receive another email saying the absolute opposite thing, or I get a phone call. So it is, I don't see that it's very hard, as I don't think I've slept through the night in 5 nights, trying to do the right thing, trying to make the right choice for students and our staff. But, I always feel like we do what's right for kids, and I know they are suffering. So if we can look to things, like I said, to even try to get that somehow a little bit more in person. But I do not see how we can logically go back in this timeline.
So do we, going back to something I had said before, do we challenge staff and administration to come up with ideas for more hybrid opportunities? We have a meeting again in a couple of weeks, I think on the 11th, that would be very interesting to hear some of those options or ideas. And likewise from the teaching staff and or parents. I mean, if there are ideas on how to make it safer in our schools, or more comfortable for our staff to feel as though we can get back for some portion of a week or some number of days in a week, I think they need to share those, and probably share them with you, Kurt.
Sure.
And with their principals and up through the administration, so that we have some of those ideas to consider as we look at going forward.
So know that this is an ongoing conversation, and all the things that you guys have talked about are a conversation we have every day.
Sure.
Keith is probably tired of me stopping in his office, or Dirk and I, that was the whole one-on-one this morning for our whole conversation. And so we're always looking at creative ways of trying to do exactly what you guys are talking about. Right?
Sure.
I want to give Michelle a
I was gonna
chance.
say, I think I realized we missed Michelle.
Thanks. So, you guys have all made great points, things that I would have said too. I think probably I only have 2 things to add. Would be you really covered the kids, and I get that, and I feel that, and I'm concerned about the kids, but I'm also concerned about the staff. I'm concerned about the mental health of the staff, that with so many of them not being comfortable going back, if we were to force them to go back, what kind of stress that could put them in. Anytime a child gets close to them, it coughs, and we can't I mean, if that's me, like, I'm not gonna be effective at my job if I'm under that kind of stress. So we want to do what's best for kids, but if we put our teachers in a position that they are stressed and can't teach very, very well, then that's not helpful. So it's really and then I guess I would just plead to the community. I mean, the community has got to be more safe. And some of the things I feel is like, people have just given up. Like, oh, it's spreading, like, we're not gonna control it, and we're not gonna be safe because we can't be safe for that long. And I don't understand that. Like, we need to do everything we can to be safe and not have this community keep getting worse.
Mike?
I agree with a lot of what you're all saying. My kids are laying in bed too. Yeah, I tell them to get out, you have a desk right next to you and that, and even reading some of the emails, especially from parents. It's hard to read it because they're sharing the story about their kids, and we can relate. We got the kids, our kids too, and these are friends of our kids that they hang out with or see in school. So it's very, very hard. It's been about 5 to 6 weeks that we've been out, and we got this will bring us probably another 4 weeks of being out.
It would be 3 weeks, it would be 12 school days, yeah.
Okay. And so I kind of just look at that, just the continuing effect of what this will do to the kids. And again, I don't want to dismiss anything what the teachers say, because I think we got to come up a plan to help both out in this situation. Obviously it seems like we're leaning towards holding off. I would say what Brian said, that we have a plan, that we have something ready to go after Thanksgiving, something that we can get in. If I just sit there and look at the numbers, they're gonna scare me all day long. But if I look at also other things like data, in Green Bay Press Gazette had a story today on this stuff, and they cited the New York Times. They said, reported last week, the data from random testing in the United States and Britain showed schools do not seem to be furthering community transmission of the coronavirus. And also pointing out elementary students especially seeing very low transmission. It was very low for elementary students, and it was unclear with middle and high school students. Again, I would like to see a plan also, just to, what is our plan? I think everyone needs a little bit of hope getting into the holidays, and I think we need, the school district itself needs a little bit of hope in all of this too. So,
Hope is a powerful thing.
yes.
So we have 9 days before our next school board meeting. And I don't know what's gonna happen in 9 days. But if we can get something that we can put together that after Thanksgiving, get a plan together that we can actually look at and say, okay, this can work, but then we're gonna have to come back together and say, okay, what do our numbers look like? Because that's the big thing right now. And number one is the numbers in Brown County. It's pretty scary. But number two is our staff. And do we have enough staff to support the kids that we have? Just like you said, those numbers are great, but how many of those school districts had the staff to support those kids? And we saw just today, we wouldn't have had enough. We would have been short, and what we would have done is the teachers that were on their prep time would have covered their classes.
And that only goes so far too,
Exactly.
and, but Thursday would have been fine, right? It's so hard to predict, right? Last week, we were okay, today bad. Last week, Monday, not good. And so it just, the other thing that I don't think people realize, and again, we want kids in person. I cannot tell everyone enough that. We really, really do. But it's not like someone gets sick for a couple of days, has a cold, and comes back. If they're quarantined, they could be out 10 days, 14 days. And so it's that long-term piece that's really struggling for us as well, right? And so, and trying to provide that quality. Now, certainly we will teach, and people have done. We've had high school teachers, we had elementary teachers, all teaching from their home when we were in person, and done really good thing, so we will continue to do that. Our staff is willing to do that, they always have been, and we'll continue to do that too. So.
Kurt, I'm glad you brought that up, because there were a number of messages that had come in and discussed the districts that have been back and have stayed back, whether it be Seymour, Kimberly, Denmark, Luxembourg, Casco. Now, some of it might be that they're more rural, they're not having the impact of the metropolitan area like Ashwaubenon may. But have we done enough communication, do you feel, with those districts to see what are they doing? Are they having staffing issues like this? Is it affecting their kitchen staff as much as has us?
Sure.
Is there anything we can learn from them that would help us as we look at trying to get back?
So good question. So first I'll start off with just the communication piece. All the Brown County superintendents meet every Tuesday, and we have been meeting every Tuesday since March. Included in that is the superintendent from Seymour, superintendent from Wrightstown, superintendent from Denmark, superintendent from West Superior. They're all in these meetings with the rest of us. And Carla and her team at Wrightstown, we're in the kitchen serving lunch just like all of us, right? And we continue to have those issues. I don't think they've been hit quite as hard in Wrightstown. Denmark was shut down for a while. They're like West Superior came back. West Superior certainly was impacted, or is currently impacted again. So I'm not sure what decisions they're gonna make going forward. Seymour seems to be a little bit more, them and Luxembourg Casco seem a little bit farther removed. It doesn't seem like it's been impacted as much, but certainly West Superior is right next door, right? And so we have talked about those things every Tuesday. Doesn't seem like, in fact, if you would ask, the superintendents, and I don't want to throw any of them under the bus, but they would say, holy cow, I can't believe all the things that Ashwaubenon's doing to keep staff safe. And you can ask our staff who have colleagues or spouses in other districts, they would say, all the hand sanitizer that we have in classrooms, all in the hallways, all the PPE that we have, all those types of things, I think we actually rocked it. And that's a real credit to our team, not to me, but to our team. And so if you would ask those school districts, I don't think some of them have done near to the level of the cleaning and all things that we have done. So from that point, right, I'm not sure much more that we could do differently. Other than we just need staff included, our community do a better job of really trying to protect themselves and do a good job, not being in weddings, not doing all these types of things, right? And so all that plays a role in it, for sure. But I don't think they've done anything different than we have done. To answer the question. That was a long answer, sorry. Other questions?
No, I think we're in this for the long haul. I think, we were talking about, this in March and, over the summer, things were supposed to get really good and, this virus was supposed to, almost go away, these, people thought at the time and now it's, November and it's, kind of unlikely, it's probably likely that we're going to be talking about this in the next couple of months for sure. So it's one of those things that we got to figure this out. And I think we just kind of have to pick a date and go with it instead of just, okay, we're going to talk about this now, we're going to talk about it next meeting, we're going to talk about it after, Christmas or December. We got to, every month. We got to put some sort of line in the sand here and said, okay.
You gotta try.
You gotta try. Yeah. And I like the blended option and say, okay, maybe it's a 1 day a week or 2 days a week. Just kind of get going and get the kids used to going back to school and seeing their teachers and all that. And I think we just gotta eventually put some line in the sand here and say we're going to go. And for the parents too, it's just I can't imagine that. My kids are older, and I can't imagine all the amount of planning or lack of planning or frustration that there is out there. We gotta figure out something here.
And we know that, trust me. And I can't say it enough, Paul, and I've said it 100 times, guys, that we want that. We want to be in person. We really, really do. If anybody, all of you know me pretty well, that are sitting even in attendance, but not maybe everyone, but most of you know me pretty well. Pretty genuine person. We want to be in person. We want to have our kids. Absolutely 100%. I cannot stress that. Our staff wants that. They really, really do. And so please understand that. Don't leave tonight feeling like that's not the case, because that's absolutely false. And anybody who says that is absolutely not true. So please know that we want to be in person. The board wants kids to be in person. If you can't hear that tonight, that certainly has resonated to me, and I'm sure has resonated to all of you in attendance and all of you listening. Our board wants our kids in person too. We really do.
It was actually quite fun to see kids come for trick or treating. We had a table set up out on the driveway, and I was in my garage, probably 20 feet away from them, but to see kids with smiles on their faces and coming up to get a candy, give them a hard time, give them, a smile back or tell a joke or something. It was fun, and the parents too, the smiles on parents' faces as they were going through neighborhoods. And granted, the numbers were a lot lower than maybe they had been. I mean, looked like some kids were out having some fun, which was nice to see.
And we truly are, and I've said this before as well, we are truly energized and inspired by our students, right? That's why all of us went into education. And that energy that our kids bring to our buildings every day, that motivates us every day to be the best we can be. And so we want that energy. We thrive on that energy and the passion and all the things that the kids bring to school. Trust me, that's really what we want to.
Okay, before we, do some type of motion on this recommendation, Kurt, I'll challenge you guys, our next meeting in November 11th, come up with a plan that we can be back in school right after Thanksgiving. And at that time, it doesn't have to necessarily be every day, all day, but some type of plan that these kids can be in school and interact.
And so they know that we could probably come up with one pretty quick. I want to say that because we've been planning on it. We want to be in person tomorrow, right? And so know that we will have something very easily for you on that day, because this is something we want to, right? And something we've been trying to come up with ways to do it as well. So trust me.
And do you think it's appropriate, and maybe it's a communication type question, that the district sends out prior to Thanksgiving with some recommendations and guidance on how you're celebrating your Thanksgiving, whether it be with family or friends or whatever, to try to keep our people safe, our kids safe, our staff safe?
Absolutely.
I think that would be a good idea.
Well, the only way to really keep them safe is to not go to Thanksgiving.
Just stay with your immediate family.
I mean, we can make a recommendation that that's entirely, them, but we can strongly suggest.
Help us out, right? Everyone, all of us in this
That's
together.
the point, yep. Doesn't mean stop living your life, because you still need to go to the grocery store. You still need to go to Target or someplace like that. You just gotta do it smart. And honestly, I mean, my perception in the community is that mask wearing has become 90% roughly. And a lot of restaurants, or I shouldn't even say restaurants, more grocery stores and retailers are not allowing you in if you don't have a mask, which is all good, all fine, well and good. So I'm not sure if we can also get some guidance from Brown County on the community spread and where is it coming from? Several weeks ago, there was a lot of in the Hispanic community, but I don't know if that's continuing or if it's spreading in other pockets or other areas. And if there's anything that we could do as a result of knowing that information. Probably not.
So if you listen to the medical staff, whether it be Dr. Rye or Dr. Ryan or Dr. Paul, all those doctors would all clearly say it stems from, unfortunately, from some family gatherings that are sometimes out of our control in regards to funerals, in regards to weddings. Those larger type gatherings would say that those are really, people have done a good job of not having these large events We still see events at different, places in town, but really have done a pretty good job. We just have to stop those larger gatherings or family gatherings as much as possible. Again, we still have to live, we still have to do those things too, but I know that you canceled the wedding.
Yeah.
For your daughter, so.
Okay.
Okay, so, the recommendation would be to extend remote learning through Tuesday, November 24th. And then with the hope and the goal that we'll be able to return back to school on November 24th, and return back to school on November 30th. Any other comments?
I still think we should probably put some sort of line in the sand here and say, we are coming back on the 30th. And I don't know if we.
I mean, we can put that in the motion, yeah, absolutely.
I wouldn't do that.
I did get emails and calls from parents who actually were asking me why, and, just because in full transparency, people did ask me this, why are we doing these short things? A couple of people actually said, why aren't we just calling it till January? Like, why aren't we doing that? You know what I mean? So I do think there are some parents who feel that way. I don't necessarily, I like hope and I like the idea that we're gonna keep trying to get back because I think we want to be back, but that's just something that I had a few people reach out to me and asking me that question, which is almost the flip of what everybody's been, just to show that different people feel
The
different.
only concern is that, okay, so we're back at our next meeting and we're down to, maybe 13 again. Okay.
Yeah.
Oh, great, let's open. And then we get back up to, the following day or two, we'll be back up to 24, 29, 31. Yeah, so.
So what good does it do to set an arbitrary date or line in the sand if you're gonna change it anyway?
We're not gonna be able to fulfill it.
Right.
So I just say that we pause until the 24th, through the 24th, with the hopes of coming back on the 30th. And then on the 11th,
We will have a plan for you, for sure.
we'll have a plan. Can we get a motion on that?
I'll make a motion. Jennifer, is that, as Jay just stated it, or do you need to restate?
No, I don't.
You got that point, okay. Then I'll make that motion.
I'll second it.
Okay, got a motion in a second. Any other comments? All in favor?
Motion
Voice,
to
want to
approve.
do a voice?
We don't have to do it.
Bandy Creek, aye.
Johnson, me.
Bailey and I.
Piscacho, aye.
Yergin, I.
Motion carries 4-1. Hey, any board and superintendent communications?
No, again, two things. Number one, we cannot stress to our parents, to our teachers and everyone else how important we want to be in person. You guys, I know I keep saying it, but I'm genuine about it. We want it to happen. We will make it happen. But we need all of you to help us with it in order to make it happen. Second thing is we have read every single email. Trust me. This board has done a phenomenal job of reading every email. I have read every email. Please continue to send those emails. We do read them, we talk about them, so please doesn't feel like we didn't hear your voice. We certainly heard your voice with the survey. So again, I want to thank our parents and all those who chose to fill out the survey. Again, we will evaluate and look at what can we do great and better in the next 12 days to even do better the work than we've done so far. And we will come up with a plan to try to get our students back in school, trust me.
Okay, can we get a motion? Let's go first. The next regularly scheduled board meeting is Wednesday, November 11th at 6:30 here at the district office.
So
I'll second.
All in favor?
Aye.
Motion carries. Thank you guys for coming.
Yeah.
So your issue is set on the date.
Thank you for these, your